let's get into the most common myth out here, which is that vaginal estrogen is the same as HRT or hormonal replacement therapy. $50 to 90% of postmenopausal vulva owners experience something called genitourinary syndrome of menopause. It's where the vulva and vagina become hostile, to the owner. And it can include symptoms like dryness, vaginal irritation, itching, increased infections and bladder infections, pain with sex. It can change how the vulva even looks, So I need to make sure you understand what vaginal estrogen is and is not. Let's get into the most common myth out here, which is that vaginal estrogen is the same as HRT or hormonal replacement therapy. So HRT refers to estrogen hormonal replacement therapy that is designed to increase the level of estrogens in the body, chiefly estradiol, the most active common form of estrogen in our blood. The purpose is primarily to treat menopausal symptoms, hot flashes, night sweats, those things caused by, menopause, which is low estrogen levels. Vaginal estrogen involves local, that means just at the vagina or vulva, low dose vaginal or vulva estrogen, specifically to address those symptoms, to address the vulva, the outside, around the opening, the vagina, the inner tube, and even urethral and bladder symptoms. Symptoms, again, like vaginal dryness and irritation, painful penetration, recurrent UTIs, and even possible urinary urgency and urethral burning. This is not the same as hormonal replacement therapy. Studies have shown that these low-dose vaginal estrogen formulations, and there are several, do not significantly increase levels of estradiol or other forms of estrogens in our blood. So multiple studies have shown this. The increased amount of estradiol seen in the blood when you're on vaginal low-dose estrogen is negligible, So what is low-dose vaginal estrogen? Well, low-dose vaginal estrogen includes very common products like vaginal estradiol 0.01% cream, brand name Estrace, vaginal tablets 10 micrograms or lower, like the brand names Vagifem, Uvifem, and Vexi. Some of these are actually considered ultra low dose. Even the vaginal estradiol ring, brand name E-string, is a low-dose vaginal estrogen. And these were not found to significantly increase the levels of estradiol or estrone or estrogen in the blood. Vaginal estrogen is not a replacement for hormonal replacement therapy or HRT because it won't increase estrogen in your blood. It won't treat any of those other menopause symptoms like the hot flashes and the night sweat. So you shouldn't be taking low-dose vaginal estrogen thinking that your estrogen is going to increase and therefore those menopausal symptoms are going to improve. Instead, local vaginal estrogen is for the very common symptoms that affect perimenopausal and postmenopausal vulvas and vaginas.
I hope this video helped somebody today. So hit that bell, make sure you subscribe, hit me up in the comments, let me know what you think, and don't miss every Wednesday right here, all things down there. Bye-bye.